The shoulder is our most versatile joint, but with the shoulder's versatility comes its weakness. Repetitive overhead motions like those performed by athletes are particularly damaging to the shoulder. Joining us now is Dr. Alan Saperstein. He is the Chief of Orthopedic Surgery for Boca Raton Regional Hospital. To tell us more, first of all, Doctor, thank you very much for joining us today.
Thank you for having me.
Let me ask you this. Most common type of injuries for athletes?
Shoulder injuries most commonly are the result of overuse. Typically, the overhead athlete puts his arm overhead hundreds of times during competition and can cause repetitive stress on the structures of the shoulder, most commonly the rotator cuff.
You know, is there anything to do, if any athletes are out there listening, that they can do to protect their shoulders from injuries, do something less or something more?
Well, the most important thing in protecting the shoulder is not abusing the shoulder, not overtraining. For younger athletes, younger pitchers, we talk about pitch counts. I think that's crucial that young pitchers stay on a pitch count and not exceed it. The other thing is form. When one throws, when pitches, it's very important that you have proper form. Errors in the way you throw the ball can have disastrous effects on the shoulder, and they're really the trainers and coaches are critical in guiding athletes.
You know, coming with athletics, there's that certain brand of toughness. Should you play through a shoulder injury? At what point should you really get treatment?
Well, absolutely not. That's really, playing through an injury can cause something that's relatively minor to balloon into something that's major. What can start as just some irritation and inflammation in a tendon can end up being a tear in the rotator cuff tendon with abuse.
When we get to that point, of course, talking surgery, what kind of surgery options are there for you know, a shoulder injury? Kind of speak about that, please.
Well, the nice thing about shoulder surgery in the past 10 to 15 years is it's really gone from being an open procedure where we'd have to make a large incision to repair tissue to an arthroscopic procedure. Nowadays, just about everything in the shoulder can be repaired through minimal incisions using arthroscopic technique.
All right, let's say you're not that young, spry athlete and you're becoming older. Tell me a little bit about shoulder pain when you get older.
Well, I think the same thing applies. You need to be careful not to overtrain. You need to listen to your body and stop playing when you do experience pain. It's very important to keep up strength in the shoulder, and it's not the major muscles, but the minor muscles, the rotator cuff muscles and those muscles that control the scapula or shoulder blade that are important, and for that often physical therapy can be very helpful.
All right. Thank you, Dr. Saperstein, Chief of Orthopedic Surgery for Boca Raton Regional Hospital, and that is the hospital that sponsors our expert and underwrites our Ask the Doctor feature.